Welcome to the Startup Grind.
That'll work.
Sure.
Okay.
This is not your standard HIPAA talk. The goal here is to kind of introduce you to what HIPAA is about, right? To kind of deal with some of the misunderstandings, misconceptions, and in order to do that, we're going to start at the very beginning.
Would you rather me advance the slides and then you just talk to it? Would that work?
Okay, which one do you want me to hit?
I think it's just the arrow key.
Yeah, I can do it. And so I told Rich this is like a 20-minute talk. So it's a very short talk. It's intended to be very interactive. Feel free to interrupt me, ask questions. And then if we end early, which is what I'm hoping for, I have 2 other presentations of other topics that may be of interest that we can talk about if you will. Most important thing here is that I'm not an attorney. I'm not here to give you specific advice. That's why you lean on folks like
But
Jenny.
I'm not here at this, but not to give legal advice, either, but thank you, I appreciate that.
You can pass out cards later.
That's right.
Get those billable hours.
We all do
He's not
that
working.
kind of disclaimer, yeah.
Goodness.
There we go. Oh, go back.
Is that right?
No.
Maybe it's better.
Maybe you should do it.
The sensitive.
So go back. Go back. There we go. The agenda.
All right, I'll just.
So we fix that. Go to the agenda.
Okay, we're good.
This is what we're going to talk about tonight. First, we're going to go over the history of HIPAA, because I think to understand what HIPAA is, you need to understand where it started. And most people haven't had the sort of brief overview of the history of HIPAA and how did we get to here, where we're talking about HIPAA, but don't actually reflect what's in the law. And then we're going to talk about some key questions. What do you need to know? Does it apply to you? How do you develop some key principles? Again, not details, but key principles that will help you make your company run better. Okay, next. So, what does the P in HIPAA stand for? Jenny, you can't talk. Okay, anyone else?
That was patient.
Okay, anyone else?
Private.
Okay, so go to the next page. So Jai is the winner. It's the Health Insurance Portability and Accountability Act of 1996. So this is a copy of the legislation. And the key thing that it says in the introduction is it does all of these things, right? So individual markets, combat waste, fraud, and abuse, insurance delivery, medical savings accounts, long-term care services, and to simplify the administration of health insurance.
Simplify, huh?
So there's only a tiny piece of HIPAA that is what we spend most of our time on. So go to the next one. And so when we start to look at the administrative simplification piece of the law, it basically says to improve the Medicare and Medicaid programs. So we're still not at anything that we talk about today. It's about improving the Medicare and Medicaid programs. And we're going to do that by establishing standards and requirements for electronic transmission of data. So what we spend most of our time talking about today is the data transmission. But the administrative simplification piece is only 13 of 169 pages in the law. It was less than 8% of the law. And of that, only a tiny percent is about data and privacy. So when we talk about HIPAA, we're not really talking about HIPAA. We're talking about a tiny fraction of HIPAA. So that's an important context to keep in mind. Okay, next. So what are some of the things that are in HIPAA that we do talk about today? So HIPAA defined individually identifiable health information. And it said, these are the folks who get it. Healthcare providers, health plans, employers, and healthcare clearinghouses. During the process of creating the regulations, this group of folks, they became called covered entities. And Jenny talked briefly about covered entities when we were chatting before. If you're not one of these things, what do you think HIPAA says about you? Nothing. So it's important to keep in mind whether you're one of these things or not. Okay, next. And then when the law passed, it said, okay, we need to put more details to this. And so they gave themselves 12 months here and then 36 months here. And then if nothing happens, then the Secretary of HHS is going to create those final regulations 6 months after that. Okay, next.
Did that ever happen? Or is it not act?
So this is a quote from a document created by the NCVHS, the National Center, I always say National Center, National Committee on Vital and Health Statistics. NCVHS ran the HIPAA regulatory process. And so after they've been running it for a couple of years, they said, okay, we've been laying the groundwork. we've got a lot more work to do. If you want to see this report, you can download it here. So I included all these links so that if you want to go back to any of the slides, including the legislation, the legislation link was at the very top. And NCVHS was given 5 years to do all of these things. So administrative transactions, claims attachments, identifiers for payers, providers, and employers and individuals, as well as code sets, security safeguards, privacy, and the electronic health record. Again, of all these things that NCVHS worked on, when we talk about HIPAA today, we hardly talk about any of these other things. So again, it's narrower and narrow and narrow. So when we say HIPAA today, we don't really mean HIPAA. It's just that HIPAA was the origin of the things that we're talking about. Okay.
So
Of
what about
those,
the origin, like, is it practiced or
what do you mean?
like the original intention is so wide?
Well, the vision was a whole bunch of things.
So they just
And the
dropped all of them?
No, the vast majority of things happened,
Okay.
but we don't talk about them. They're in the background. They're how health insurance companies share data amongst themselves. Say, for example, if you move from one job to another. So all of the data standards for how that happens came out of HIPAA. It's just not something we talk about because most people aren't insurance companies.
Yeah.
Oh, okay.
Okay.
Of these things, so go ahead.
I'm at Fidelity when we manage 401ks,
Mhm.
right? So all of a sudden, we're in the HIPAA world, even though we're not any one of those. But we work with employers, so therefore we,
Not necessarily.
Committed by.
our legal counsel would have disagreed.
Okay, we probably should get a little farther in, but
Okay.
here's let's get a little farther in and we'll come back to that question. Go back. So, they did not create a national patient identifier. This is the document that explains why. And if we want to go into this in more detail, I do have a separate slide presentation on patient identification. So we can talk about that after this is done if you guys have interest. Next. So Bill Braithwaite was the head of NCVHS when they did HIPAA. He was also called Dr. HIPAA in the 90s. And he said this: don't let your attorneys write the rules and ask your attorneys if they can defend them. And the reason he said this is because a lot of attorneys make the rules as tight as possible to avoid being sued, right? It's a perfectly rational thing for them to do. The challenge was it made it harder for you to operate as a healthcare entity. And so what he was saying is, yes, you have to follow the law, but create your rules first and then talk to your attorneys about the details and make sure that these are defensible rules. So I don't know if you want to make any comment about that.
No, I totally get that.
Okay. Go ahead, Max.
I feel it's good.
We talk a lot about what's your risk profile here.
Yeah.
So what does HIPAA require to start? So the first question is, are you a covered entity? Well, the answer is, it depends. Are you providing services? Are you Teladoc? Are you providing healthcare services? If you're providing healthcare services, that makes you a provider, that makes you a covered entity.
So medically tailored meals would be covered under this as a provider? No,
Not, probably not.
because it's community support and not like a health provider.
So if you're not a clinical provider,
Okay.
a health insurer, or a hospital,
Yeah.
you're none of those things, you're not a covered entity.
Okay.
Okay? So that's the question is, are you a covered entity? So here's the rules about what a covered entity is if you need to double check.
But she deals with health insurance
But
companies.
you're a business associate.
We're gonna get
That's the
to
BAA.
that in just a second.
Yeah, wonderful. Yeah, I have one.
But the first question is, are you a covered entity, right? So if you're a covered entity, you don't even need to ask any of the other questions. You're a covered entity, you need to follow the rules.
Okay.
Okay? So what obligations do you have? Well, again, it depends on if you're a covered entity or not. If you're a covered entity, you have all of the HIPAA obligations. If you're not a covered entity, then the question is, do you work with people who are covered entities? If you work with people who are covered entities, they don't want to take the risk of you screwing up. So they will have a legal agreement called a business associate agreement or a BAA that defines what you have to do in order to remain their partner in whatever it is that you're doing with them. So if you're working with an insurance company, they will require you to have a BAA because they're a covered entity and they're not going to take risk for anything you do that they disagree with. Okay. So, anybody else here have a startup? Anyway, now let's talk about your point. So if you're managing investments, you're not a covered entity.
Oh, no, I know.
So why would your attorneys think that you have to follow HIPAA?
Because you have 401k plans, you have healthcare plans. And
Well,
then we
401k is
have
not about that.
access to the data. And therefore the insurance companies or the employers require a business associate agreement And therefore, at least that's the definition I've been told.
Okay, so are you working with health insurers?
Yes.
And what are you doing with the health insurers?
Is somebody covered or not?
Are they covered for insurance?
Been covered for insurance?
Okay, then
Okay.
yes, you would need a BAA because you have an agreement with the health plan. So it's not because you're Fidelity, it's because you're having a business's relationship with a health plan. That's the reason why.
Yeah.
So aren't we
Enterprise
the same?
processing protect health information.
Yeah, so we're the same, basically.
Right.
Protecting PHI.
Yeah, we are. We have PHI. So we are required to follow HIPAA then.
You're required to follow what's in your BAA.
Mhm.
So the BAA will explain the things they expected. Now, if the BAA is general, if it says things like, you'll be up to date on what the current OCR requirements are, then that's what you're going to have to do. And again, this is where it comes back to the specifics of your situation you need to work with your attorney on. We're talking about the highest level of first, are you a covered entity? What are your obligations if you're a covered entity, and what are your obligations if you're not a covered entity? And do you have a BAA, in which case then that changes what your obligations are.
Did you get a BAA? Or do you
I
know?
got a contract from Anthem, and in the contract, they said we have to follow, the security, requirements to protect the
Did they
PHI.
talk about the privacy rule, security rule?
I don't remember. It was long, 17 pages.
ChatGPT.
Oh, yeah. I did read everything, but I can't read back. And I'm an immigrant, so my English, and I'm like,
I'm pretty sure your business associate
Oh,
agreed
yeah.
on that in that agreement.
yeah, I'm sure.
70 pages.
Yeah.
Hey,
Yeah.
Okay,
Next.
so what kind of generalized development principles can you use? All right. Follow industry standards. If you understand what NIST and OCR expect, and you build that into your process, you're going to do a whole lot better. So here's a link to the NIST framework, and here's a link to the OCR requirements for professions. So this will give you some high-level understanding of what do we generally have to do. And again, if Rich hasn't already, he'll make these slides available so you don't have to copy this stuff. Be patient focused, right? If your focus is on how do we make the most money, you're going to get into trouble. If your focus is on how do we protect the patient, you're probably going to do better, right? So if you go with these two sort of as a high level strategic principle, you're going to be in a much better shape for managing the details. Any questions about that?
So if she has a BAA and she's working with other vendors, does she have to extend that to them as well?
She should.
Yeah, like our Google Suite, so we're using like a third-party software, so we signed it with them too.
Yep.
And everyone we work with, they have to apply. Like we have chefs that are independent contractors, so we have a contract with them where they.
Well, it depends on what data you're sharing with them. Because if you're not sharing any PHI with them, if
Well-
they're just meal prep and meal planning and recipe type stuff, as long as there's no PHI, you don't necessarily need to be A with them.
According to the definition that we got, is even sharing their, so all of the health patients are in a separate system. So the chefs know that they're related to health. They're not general public, and they have specific meals, and they have access to their account where the patients fill in information. So it's not.
So they have they have access to that
They have,
information?
it's just their account. If the patients say, I need diabetes-friendly meals, that's PHI. And according to the definition, I think even there.
Well, it's not PHI if it's just, I'm some random number and I have diabetes.
It's there, yeah, they don't have the number, like we separate the data, from the health plan. It's all like in the health plan world.
If you
We've done the import.
if you compartmentalize your data so that any data that you share with a non-covered entity has no PHI, then you're going to meet your BAA requirements.
It is not identifiable to a
Exactly.
patient.
We did, just to be careful, all the chefs are going through HIPAA certification and
Interesting.
training. So
Okay.
they're all certified, background checked, so like just to make sure in case they do, they go into people's homes. So they might get
Oh,
some
okay.
information.
Then yeah, they need to be.
Yeah,
So do you have a BAA with them?
It's part of, we incorporated into the extension of the regular agreement we have with them. So it's like an extension, and we added the BAA
Okay.
requirements.
Yeah, what's going to get complicated though is if you have BAs with multiple health plans and the requirements are different.
Mm.
That's where you're going to really need to rely on your attorney to say, okay, what are the commonality
Yeah,
clauses
so we
here?
can.
So we can make it so that all of our people.
But the new business that I didn't tell you this, but we have a partnership with Community, didn't work with Milpro. But anyway, so they're doing delivery, which is much easier. Then no one goes into no one's home and the chefs don't know the information about the patients. It's just delivery. So it simplifies all of this.
Again, anytime you can compartmentalize the data, your
Yeah.
job will be easier.
Exactly. So that's my goal, to simplify, keep the data away from like the minimum people see, the better.
You have to be careful though, if you're switching from personal, like protected health information to just regular PII, they have their own regulatory compliance for those. They're having their addresses, their names, all
Yeah.
of that. You switch to a different set of stamps.
CCPA. Yeah.
Yep.
Yeah.
Oh, yeah.
Well, in FTC.
Yeah.
Yeah, they have lawyers, and they're a big company to do delivery already. I think they're even practicing even better than us. So it's like it's moving from complicated to less complicated world, which I can sleep at night better. I love it. Thank you. But yeah, it's a good point. Yeah.
So next,
Oh, sorry, just let me take a picture.
okay. Prove that we were actually here.
Yeah.
Okay. What everyone I hear from you? Well, you can say you're HIPAA compliant, but there's not actually any such thing. It doesn't actually exist. There's not like, oh, we can check this off and say we're HIPAA compliant. No, it's not. It's not a thing. It's hard to prove that you are. It's hard to prove that you're not.
What do you
because there's
say
not a thing.
then? You follow HIPAA guideline? Oh,
No, if you're a covered entity.
Yeah.
So you can say we are or we are not a covered entity. No, if you have a BAA. And if you have a BAA, great. And if you can tell them that we're not a covered entity, we've signed BAAs, but otherwise HIPAA doesn't apply to us, that's the answer. Right? So a lot of people say HIPAA compliance because it's easy. You can sign up for it. You can get entities to say you're HIPAA compliant. It's a common statement, but I don't think it actually means anything. BAs we talked about a little bit, but basically you just have to know who your customer is. If your customer is the patient and you're not sharing any data with anyone other than the patient except as the patient's request, HIPAA doesn't apply to you. Again, you're going to come back to some of the other things that apply to you, but HIPAA does not apply. So again, when you talk to them, to focus on we serve the patient, right? To the extent that you can say that, that's a good way to go. And we follow best practices. And if you do those two things and you know whether you're a covered entity and whether you have a BAA, that's pretty much what people want to know. So people tend to fall on the HIPAA compliance because it's easy, but it doesn't actually mean anything. Okay.
So if we if we're working with a dietitian company that provide a nutrition assessment, and what I need to do is basically sign a BAA agreement with them to support the BAA I committed to Anthem, and then make sure that they comply, and then we should be okay. Basically, like and it's structure.
Sounds like a flow down, right? So
Yeah.
Anthem's having you send this will be,
Mhm.
you want to make sure that the one that you're having them sign is just as restrictive as we say in legal terms, yeah.
And more than that, you need to have a process in place where you're verifying that they're meeting that, right? Because you're obligated even if they screw up, if they got a business, then you're on the hook. So you still need to make sure that you have a process in place, that whatever agreement you have with them, they're actually
Compliant.
following.
Do you have someone who does third-party risk management for you to help with all of that, making sure that you have the frameworks and the systems in order to have that done? Okay.
TA Marketplace, we got $500,000 approval from the HCS to work with consultants that are helping us put all this framework. So I created some of it, but it's, again, that's not my profession. So they're now putting everything in place.
Okay, let me know if there's any help as well.
Oh, wonderful. Yeah, would love to take your information.
next one?
As I say, in terms of documentation policies and security. So documentation, make sure you're clear about what your internal processes are. Make sure you have standard procedures that discuss employee training. Because you have to remember that your weakest link in your organization is your employees. And if you don't train them well, that's on you. And then talk about how private security and confidentiality is managed in your documentation. And then in terms of the policies, you want to have clear policies for the data lifecycle. How do we follow the data from when we get it to where we send it and how we store it in between?
We got data mapping. Do you know where your data is?
Yep.
How long you retain it as well.
And then again, for security, NIST is sort of the minimum, but you want to supplement it with HIPAA guidance from OCR. And then if you want to keep up to date on what's going on, sign up for the OCR mailing list, and they'll keep you posted as to when things change.
Next one.
And are those the things that you do now in your own business? Oh, I just a question. Is this something part of your practice today?
I don't spend a lot of time with HIPAA anymore. I spend most of my time on healthcare policy.
Mhm.
And so, for example, I'm working with the End Burnout Group. Our goal is to end clinician burnout, and we've identified 20 root causes of clinician burnout. And right now, the one thing that we're working on ending is prior authorization. We want to make prior authorization illegal. So if
Prior
anyone,
authorization illegal?
Mhm.
Yeah.
Yeah.
So much.
Yes, of
That
course it
would be
does.
So good.
So we would love to have everybody here join us in this effort.
Yeah,
um,
please succeed.
We're gonna,
What-
we're
what-
gonna-
can
we
you
need
explain?
hundreds of thousands, if
How
not
many
millions of people.
hours of a doctor's life is spent doing that?
I'm so glad you asked. Far too many. We can go, if you want to move from this conversation, I brought my prior auth slides as well. And then the other thing that I brought is the patient identification slide. So we can move to either patient identification or ending prior auth. Either one is fine. But I spend probably 70% of my time on health policy. I spend about 20% of my time working with health tech startups.
Mhm.
And then the other 10% is sort of administrative over and other kinds of things.
I've spoken to so many doctors who like left, they're like, you know what,
Yep.
I'm concierge, I'm
Yep.
private, I don't wanna deal with that.
Yep.
You're gonna pay me from your bank account, there's nobody else
No.
here, they don't do it anymore, and it hurts the public
Yep.
so much.
Exactly. No, prior auth is unconscionable, that we allow it and that we allow people to be harmed and killed because health plans.
Well, you know, just, I'm on Sutter right now, and I feel bad when you talk to somebody that's just customer support, because they're not making the rules.
Yeah.
But I got this message that kind of concerned me. They gave me this number and saying, you know, this is what your next bill's gonna be.
Mhm.
And when I called them up, they go, oh, that's actually pre-insurance. Like, why are you sending that bill to me?
Yeah.
You know,
I know.
yeah, so I don't know, yeah.
Well, for the record, the two most expensive health systems in the state are UC Davis, followed closely by Sutter Health in
Really,
the state.
those are the two that I use. My specialists are UC Davis.
Ay.
Yeah, partly it's because in Southern California, they have a lot more capitated care. And so if you look
What do you
in
call it?
capitated care, if you look in and around LA County, the rates for hospitals there are much lower than they are up here in the north.
Really? Yeah, here it's outrageous. I
Did Sutter, I feel like it was a few years ago, was it OBs or deliveries, somebody got really slammed for how crazy expensive they were.
Maybe, it wouldn't
Yeah.
surprise me.
uh,
Anyway, other questions about HIPAA, now that we put HIPAA in context?
I'm just curious that the training, I know that's a challenge for my clients on the work I do. How do you, I don't know if you see that much into, again, the healthcare startups. Are they doing it? Are they finding a way to do it? Because I guess.
yeah, we do. Yeah, at least,
Okay.
you know.
So do
I
you
have several
outsource,
resources. I
do you
outsource,
look to
yeah.
a vendor?
Yeah,
Okay.
$29 worth it, you know, do the
I'd
training.
be curious to do,
Happy to share.
I'll
Yeah.
follow up with you.
Yeah.
What's $29?
They give you like a training. So for security training, you
Is
have
that 29
one,
per head?
but then per head for
Per user.
privacy, per user. Yeah. So
Like
anyway,
asynchronous?
yeah.
Yeah,
Mhm.
okay.
It's like it takes an hour and
No.
they give you a certificate after.
Something to add to your LinkedIn.
The what?
Yeah,
I get
LinkedIn.
LinkedIn, right?
HIPAA compliant.
Yeah, not something I would be proud of.
Took me an hour.
It's-